Welcome to Bear in Mind, the Brown Psychiatry Podcast, clear, current content about mental health. I am the host, Dr. Tracey Guthrie, Psychiatry Residency Program Director and Co-Editor-in-Chief.
I'm Dr. Camila, Cosmo, Psychiatrist and Co-Editor-in-Chief.
And I am Dr. Amy Johnson, a Child Psychiatry Fellow and Script Editor for today's episode.
First, a content warning.
In this episode, we will talk about sensitive topics, some of which you may find triggering. Our only purpose is to provide education and information. Our content is not to be considered medical advice.
According to a study in the Journal of the American Medical Association of Pediatrics, rates of anxiety and depression in children ages 3 to 17 increased by almost 30% from 2016 to 2020. The CDC's Adolescent Behaviors and Experiences Survey found that 37% of high school students identified their mental health as not good most or all of the time during the pandemic. Another CDC survey in 2021 showed that 30% of high school girls and 15% of boys had seriously considered attempting suicide. Unfortunately, suicide remains a leading cause of death among children, adolescents, and young adults. There are also disturbing trends in youth hospitalization rates. Between 2009 and 2019, pediatric hospitalizations for mental health diagnoses increased by more than 25%. From 2011 to 2020, the number of emergency room visits related to mental health for kids and young adults aged 6 to 24 years old increased from 4.8 to 7.5 million per year.
These data clearly indicate that the COVID-19 pandemic worsened the problem. By October 2021, three important national organizations, the American Association of Pediatrics, the American Association of Child and Adolescent Psychiatry, and the Children's Hospital Associations, declared a national state of emergency in children's mental health. They emphasized the urgent need for increased funding and attention to these issues while highlighting the disproportionate impact on communities of color and those living in poverty. Thankfully, in the fall of 2022, there was a decrease in adolescent ER visits for mental health conditions compared to the previous year, suggesting a decline in the surge. According to the CDC researchers, the return to pre-pandemic environments such as school may have contributed to this improvement. However, it is still critical that we continue working to improve access to mental health care. As described by the Surgeon General in a 2022 advisory, protecting youth mental health, our obligation to act is not medical, it's moral.
So join us to talk about the mental health challenges commonly experienced by children and adolescents is Dr. Tammi-Marie Phillip, a specialist in child psychiatry. Dr. Phillip serves as an attending at the Adolescent and Young Adult Service at the Butler Hospital. We are grateful to have you here today. Welcome, Dr. Phillip.
Thank you so much for having me.
Yes, welcome. What are some of the most common mental health diagnoses among children and adolescents?
Yeah, so some of the most common ones we see fall within the anxiety realm and the mood disorder realm. So we see a lot of kids with generalized anxiety disorder, social anxiety, and a lot of major depressive disorder as well.
And Dr. Phillip, how do mental health diagnoses impact kids who belong to minority groups? What is your understanding about it?
Oh, it does so in a very great way. So, when we have kids who identify as coming from minority groups, we tend to see that those kids tend to have less access to care. There's a lot of misdiagnosis that goes along as well. And, there's been a lot of work in the field and a lot of research that's been done. For example, having a Black male coming in with symptoms, same as a white male, the Black male tends to have a much lesser chance of being referred to appropriate levels of care compared to his white counterpart. There's also a lot of mistrust within the medical community, understandably so. And so people tend to try to seek out help a little bit less. And also there's, the difficulty with representation. It matters. And people, like working with people who may understand where they come from, what they look, who look like them, who can sort of have that cultural competence in a way. So, it really sort of affects across the field in terms of access, treatment, and overall outcomes in a pretty significant way.
And what are some signs or clues that a child or adolescent may be experiencing mental health challenges?
Yeah. So, it really sort of varies developmentally. In the little ones, what we tend to see are more physical symptoms. So, things like headaches, upset stomach, I have abdominal pain. They may not be eating well or sleeping well. A lot of times they could be more irritable, more restless, have difficulty paying attention. So these are some of like the big red flags that we'd look for in the little ones. And just, these, all kids will sort of have these from time to time, but it's important that we look at the amount of time that it's going on for. Mm-hmm. So roughly about 2 weeks, if we see this persistently, then sort of saying, okay, maybe we should look into this a little bit more. In the older kids and in the adolescents, what we can tend to see, they may be able to express how they're feeling a little bit more. So they may appear more sad, more isolated, more withdrawn, the same sort of symptoms we see with red flags we see with the little ones as well. But that's when we tend to see more of, is there substance use? Is there self-harm? Are they expressing having unsafe thoughts or suicidal thoughts? Because they tend to be able to express that a little bit more. And all of these would be red flags that, okay, maybe we need to have this child evaluated by a professional, by their pediatrician or somebody who works in the mental health field to sort of figure out what the next steps could be.
What treatment options exist for children and adolescents? A commonly used medication, selective serotonin reuptake inhibitors, or SSRI, has a quote-unquote black box warning of increased risk of suicide listed. Is this something parents and guardians should be concerned about?
Yeah, so this is something that comes up very, very frequently because it's terrifying, right? You're wanting to help support your child. They're depressed or anxious. And now there's this medicine that we're talking about that one of the potential side effects is increased suicidal thoughts. In actual clinical practice, I don't see it very often, in all honesty. What we see by and large is untreated depression, untreated anxiety has a much higher risk of leading to suicidal thoughts than the medication itself. And so for many kids, especially when the symptoms are impacting their functioning and their safety, together with therapy, and therapy is the most important piece in this, together with therapy can be very effective treatments for children.
So, Dr. Phillip, how has the landscape of pediatric mental health changed during the pandemic?
Oh, it changed significantly. Pre-pandemic, for example, on the inpatient unit, so what would lead to an admission, what would the criteria for an inpatient admission is much different from what it is now compared to pre-pandemic levels. Kids are presenting a lot sicker, and they've been sicker for longer. And a lot of that has to do with the access to treatment at lower levels of care. I think there are a lot of kids who were sort of keeping it together for a while, and then COVID hit, and then it just threw everything over. And, when you think about kids, kids don't exist in isolation. You're really thinking about the family units and the family structure. And for a lot of families, COVID was the thing that really sort of, toppled a lot of stuff over. And so now we're seeing a lot increased need, but not necessarily an increase in the resources. And so it's really sort of changed, and how we sort of triage care, how we, really are thinking about delivering care, how we're sort of trying to get kids to access care. And a big part of it is sort of thinking about where can we reach kids the most. And, I think about this a lot. And I think one of those places is schools, right? Because that's one place where hopefully they're there consistently. And if we can reach kids in schools, it can really sort of change the trajectory for a lot of kids.
So can you talk a little bit more about the impact of social isolation for the kids' mental health?
Yeah, it was significant. Children developmentally need socialization, right? It's not a want, it's a need for development. And when you strip that away, kids are now spending more time in front of screens, less time with their peers. Part of socialization is sort of learning how we function in this world. And you take that away and there's nothing that can replace that. And so now kids are sort of sitting in front of screens, not having that typical socialization that they need for development. A lot of times they're unmonitored, and there's a lot of information that is just sort of there for them to access and use in whichever way they want without having the skills to properly use them. And also, in some ways, we had, social media provided that connection that people were missing. But in a lot of ways, it really just provided greater avenues for, bullying and things like that. But the social isolation piece for kids really sort of on a very biological level has impacted this generation of children. And I think it's just a matter of time before we start seeing the long-term impacts of that.
I was wondering, what are some of the myths that exist in the world of child and adolescent mental health? And what would you like our listeners to know about those myths?
Oh my God, there's so many. I grew up in a culture that didn't really think that children experience mental health, any mental health issues. And it was, if a child did exhibit those symptoms, it was, because you're a bad parent or because they were not disciplined enough. When in reality, kids experience mental health conditions in the same way that adults do. And our approach can't be more discipline or blaming the parents. It's really providing effective treatment for these conditions. Another big one that I hear a lot is that, my child's little, why would they need therapy? Children can't engage in therapy. And that's not true. Children can have, and actually in children and adolescents, that is primarily what we sort of focus on as a primary intervention. Even when medications are involved, therapy piece needs to be there as well. And very, very young children can benefit in significant ways from therapy. Another thing that we see a lot of is with the world of medications, either that there is a medication that's going to quote unquote fix things. That doesn't exist. It really just doesn't exist for anything really. But really recognizing that medications can be a helpful tool, but especially in children and adolescents, they're not the answer. They're not the end all in treatment. And then on the flip side, one of the myths is that, child and adolescent psychiatrists, all they do is push medications. When in reality, it's, for us to get to the point where medications are recommended, it's really when we've sort of optimized every other avenue that we can. And for many kids, it can be an important part of treatment, but is by no means the number one piece at all.
Right. How could adults start a conversation with their child or adolescent about mental health?
I think that's something that starts from little, normalizing emotions, normalizing talking about how we feel, normalizing identifying emotions. I think of dropping my kids off to school as a time when, I have them in the car and we're going to talk about, and my kids are little, how are we going to talk about how you're feeling, and sort of setting that safe space where that dialogue can happen and really making it a priority to do that and, modeling it. I think a lot of what we as adults should do is really sort of model what is like healthy communication about how we're feeling and that it's okay to experience all of those things.
And talking about social media, in what ways has social media impacted the mental health among young people?
It's a double-edged sword. In some ways it's created this people are more connected. And so in those times of like social isolation, like what we spoke about, these were some of the only connections that kids were having. For some people, social media really can, be a place where they're learning more about themselves and how they can sort of deal with their self-care and manage things that they may be going through. And there's like wonderful like apps and pieces of social media that can really help support mental health treatment. But on the flip side, what we've done is we've sort of opened up, kids to all sorts of information. And, a lot of it is misinformation, right? So they're sort of going in, not having the skills and the tools to sort of decipher what is actually real and not, and using that, going forward. A lot of what we've been seeing recently too is a lot of social media content generated towards certain things. So for a while we're seeing a lot of kids who had quote unquote tic disorders because there was a lot of social media content generated around tic disorders in a way that everybody could sort of relate to it. So you see this and you're like, oh, I see myself in this. And there was a huge surge of everyone having what they thought were tic disorders. Now we're sort of with the neurodivergence. So we see a lot of people relating to content put out about being on the autism spectrum and really sort of searching for these diagnoses because this content is very relatable. And what we, a lot of times it may not actually be, this is not how we diagnose these disorders. And that can create some sort of tension sometimes within the treatment.
And how would you recommend that an adult respond to a child if they express feeling unsafe?
Yeah, that's a good question. It, I think, really depends on sort of the relationship that you have and the level of concern. So regardless of the level of concern, a child who's expressing having unsafe thoughts should be evaluated by somebody who works within the mental health field. Now, I think having those conversations can mean the difference between, all right, you're having these thoughts, we're going to go speak to your therapist today or tomorrow, versus I'm very, very concerned about your safety. We need to go to an emergency room where you can be evaluated to see if you need a higher level of care. And just knowing that it's never wrong to bring your child in, if you're concerned about their safety. It's never wrong to bring them into the emergency room and having somebody evaluate them to see what might be the most helpful approach.
What changes are being made in the mental health field to combat this climbing severity of mental health conditions in child and adolescent psychiatry?
Yeah, I think one of the good things that has come out of this is that mental health out of COVID has been that mental health is now on the forefront. So we're talking about it more. People are more open about it, and we're normalizing it. I mean, when you think about it, about 20% of the population struggles at some point in their life from a serious mental illness. It's touching every family, right? But these are things that we've been keeping in secret, and now we're sort of speaking about it more. There's a lot of work that's being done in the community about, introducing like social and emotional learning in schools, really teaching little ones from the time they're very little, identifying their emotions, teaching them age-appropriate coping skills, teaching them about self-care and meditation and yoga in very age-appropriate developmental ways, and sort of building on those skills throughout the years. Introducing mental health treatment in a more formal way in schools is another thing that's being done. Also, working on how can we support our minority populations in a way that's culturally appropriate. There's a lot of work being done around that. There's a lot of work being done on the ground to help the progression of these mental health disorders, and to sort of get those interventions in very early on, so we decrease the need of people needing more acute levels of care, like inpatient hospitalizations, being in the emergency room, and things like that.
And what steps can community members take to reduce the stigma associated with mental health illnesses?
Things like this, continuing to talk about it, continuing to, be open about it, normalize it. This is not the exception. There are a lot of people who are struggling about it. And the more that we can hear about people who struggle, and also recognizing that this is not, if your child has a mental health condition, this is not the end of the world. This is not the end of the world. Children can go on to thrive and do everything that they want to in life. And what we know is that, like with many conditions, early intervention is extremely successful. So having these conversations, having these platforms where people can talk about, their own experiences, their experiences in treatment, having places where people can know what they should be asking for treatment and learning how to advocate for themselves are all things that I think we can continue to do as a community to help reduce the stigma.
And what national resources are available for children and adolescents facing mental health challenges?
So when thinking about resources, the way I like to think about it too is how can we help support the entire family, because children are, existing within this structure. And the National Alliance on Mental Illness, NAMI, is very good information, very helpful information, both for persons struggling with mental illness, but also how as a family unit and people around you how you can support someone struggling with mental illness.
And how about locally here in Rhode Island? What resources are available to our local community if they're struggling with a child or adolescent with mental health problems?
Yeah. So, I mean, one of the ways to sort of, if there's a crisis or a concern, you can go into any emergency room and have your child evaluated. At Butler Hospital, we have a range of services, from outpatient services and as well as partial hospital services, which are also called day programs, where kids come in for 5 hours of treatment a day. And they work with therapists and in group therapy, all the way up to inpatient admissions, where we stabilize crises on an inpatient unit. We also have through Lifespan similar services as well. And the easiest way to sort of access those resources would be either talking to your mental health provider or your pediatrician, or coming into the emergency room if there are significant concerns and getting the guidance from someone on the ground doing the work.
And in the partial hospital setting, it's 5 hours and they go home at night. So they're home with their family.
Yes.
And they come back the next day for sort of a more intensive outpatient intensive partial hospital program. Is there, for older kids, is there an intensive outpatient program also available?
So there are intensive outpatient programs available in Rhode Island. Butler Hospital doesn't have an adolescent intensive outpatient program. We have multiple young adult intensive outpatient programs here. But there are some adolescent inpatient intensive outpatient programs available to provide support.
In the state of Rhode Island?
In the state of Rhode Island.
Bradley Hospital?
Through Bradley Hospital. Yes, there are some really good ones available.
And when you say young adult, what age group, what should people think about when we think of young adult?
So we're thinking like 18 to 25, 26. Okay. And, over the years, it's become very clear that, adulthood doesn't really, you turn 18 and then suddenly you're an adult and you know how to live as an adult. Right. And it's really a unique time developmentally where children are learning to transition into adulthood, and that doesn't happen overnight. And there are a lot of programs now, and a lot of fields of medicine actually now have a young adult track where we really focus on that transition between childhood and adulthood. And it's really between that 18 to 25, 26 age group.
Wonderful. Thank you.
Thank you.
And just for our listeners, could you differentiate between intensive outpatient programs and partial hospital programs?
Yeah. So, it's a whole continuum. So at your entry into treatment, you have your, what we think about like your outpatient therapy. So you see your therapist once a week, you see your psychiatrist every so often to manage medications if you're on medications. The level above that is what we call an IOP, so an intensive outpatient program. And they vary. Here at Butler, we have multiple young adult IOP programs that meet for 3 hours a day, 3 days a week over the course of about 4 to 5 weeks. And during that time, patients are meeting with a therapist, they're in groups, and they're getting support from a psychiatrist if medications are involved. Then you have the level above that, which is the partial hospital program, or what we call day programs, where people are coming in every day consecutively, not the weekends, but every day, and they're coming in for about 5 hours a day, where they meet with a therapist every day. They're in groups, and they're also meeting with a psychiatrist as often as needed if there are medications involved. And then the level above that is the inpatient level of care, where people are actually sleeping at the hospital. And what we tend to do is, if we have people who are on an inpatient unit, we know that the times that people tend to struggle the most are at those times of transition. And so when we have people stepping down from an inpatient unit, we want to make sure that there's a lot of support available. And sometimes that can be through the route of having a partial hospital program, just so that you continue through at the times when you need more support.
And one of the other myths, going back to your earlier question about length of stay in the hospital, I think some people still have this view that coming into the hospital, I'm going to be there for an undisclosed amount of time, and it's going to be an eternity. What is the average length of stay for a child and adolescents these days?
So here at Butler Hospital, our average length of stay is 7 to 10 days. And, a lot of our focus is really empowering a child to take ownership of their treatment. So teaching them, coping skills that they can use, having them understand more about why they feel the way that they do, and then sort of, having them transition home at a point where they're not actually then starting to learn how to live in the hospital. And that can then make that transition harder. So for a lot of our kids, in the way that we sort of approach treatment, that sweet spot is about 7 to 10 days. There are kids who spend shorter, there are kids who need a little bit more time, but it's not a situation where kids are spending 6 months or a year. And we see this a lot. It is a myth. Kids coming to the hospital, I'm going to be here for like 6 months. No.
Right.
No, we're not going to. No,
Right.
because, we really want to empower you to be back home with your family, but in a way that you can manage.
And their family can see them while they're in the
Yes.
hospital. That's another myth,
Yes.
that I'm coming into the hospital and I won't be able to see or talk to anyone.
Yes.
And so visitation is encouraged. Family meetings are held. The
Yeah.
family is integral
Yes.
in this, and they're not pushed aside. They're invited in to come in and be part of the treatment of their child.
They're an incredibly important piece of the treatment.
Absolutely.
First of all, we're working with the whole family.
Right.
And second of all, parents are the experts on their child. We're meeting children for a very brief period of time. We need that family involvement. We need this working together for the child to be successful. So, it's strongly encouraged that parents come to visit and spend time with their kids. We have family meetings. We're on the phone with parents every day, sort of working through these issues together.
So just jumping back to social media, we were talking about it earlier, and I was thinking, do you have any specific advice for a parent or caregiver for how to help children and or adolescents around social media, since it can be detrimental in a lot of ways?
Yeah, that's a tough one. It's social media has become so prevalent now and such a big piece of the fabric of our culture. And in a lot of cases to say, nope, you're not going to use social media until you turn 18 doesn't really work very well a lot of times, because kids are going to find a way. The approach that I tend to find more successful is really teaching kids how to use it appropriately.
Yeah.
Really working with them on what is appropriate use of social media, and then creating that safe space where kids feel comfortable talking to parents about challenges that they may come across while using social media. There are a lot of apps as well that can sort of alert parents if children are using social media inappropriately. Like there may be some keywords that can pop up and flag and say, hey, you need to look at this a little bit more. And that's one way in which parents can have more of an idea of what kids are sort of using social media for. But I think a lot of our work now has to just be on how do we use this appropriately?
And we hear often from parents and caregivers about their concerns around some social media trends, like TikTok trends. And what are the most common ones, and how can they impact the mental health for kids?
Yeah, there's so many, and they kind of come in waves, So, like we discussed, there was a whole wave of tic disorders. Then there's been a whole wave of autism spectrum disorder, and then there's been a lot of trends around suicide and self-harm, and glorifying self-harm and glorifying suicide. And we see that, working on an inpatient unit, there will be times when there are a lot of people sort of coming in with similar presentations. Part of the work that we want to do is empower parents to support their children with this and recognize when these things are happening. And something that happens quite often that we see a lot, especially on the inpatient unit, is parents get very nervous around parenting when kids are not doing very well.
Right.
And what we know is that if you stop parenting, it's not going to help. It's going to make things worse. So you hear a lot of, well, she's pretty fragile, so I don't want to do that. So I just say yes for whatever she wants. That doesn't tend to help. And it's the same sort of thing around social media, that it's important that parents continue to have these boundaries, set these expectations and these limits, and that everybody's aware of that. And while also recognizing what their kids may sort of, be struggling with and where that's coming from. But it's a very real issue. It's a very, very real issue, because people are very savvy with the content that they're creating. And our kids are, sort of put into the world without any ability to sort of, make those choices, before they can actually properly make those choices for themselves. So it's just something that has, been very, very concerning recently as well for people working in the field as well as parents.
And what would you recommend for parents and caregivers that are right now struggling with kids that are feeling suicidal? How can they start that conversation?
If you have a child who's expressing suicidal thoughts, whether it be thoughts of, sometimes I just feel like I don't want to be alive, or thoughts to the other extreme of I'm going to kill myself, it is extremely important to have this child evaluated by somebody who works in this field and somebody who can help figure out the next steps of treatment, because suicide is not a phase. Suicide is not something to be taken lightly, and it's something that we need to intervene on. And so, having somebody who can sort of lay eyes, work with your child, figure out, does this child need to be on an inpatient unit, or does this child need to be in, increased visits with their therapist or start seeing a therapist? All of those decisions need to be with somebody who works in the field, whether it be your pediatrician, whether it be your therapist. And what I say to a lot of parents who are sort of struggling, especially parents who have kids who've been really, really struggling with their safety, this is also important for some parents to get their own therapist, right? Because you're dealing with a very, very difficult situation. And it's important that you yourself are also taking care of your mental health while trying to support your child, because you can't really support your child if you yourself are depleted, right?
One of the things that is really important that we talk about all the time in psychiatry is access to weapons. And I think that this particular topic from the view of a psychiatrist is it's a public health crisis, that particularly people who are going through a mental health crisis should not have access to weapons. But first you have to identify that this is an issue and take steps. So for people out there who are and identify themselves as law-abiding gun owners, and they've taught their child all about their gun, but now they know that they're dealing with a statement about suicide, a statement about not wanting to be here anymore, and they feel confident in their own education about weapon security and all of those things. What should they do at that point in time? Now you have a gun in a home with someone who has expressed suicidal ideation, child, adult, whatever. What is the advice that we should give as psychiatrists, that you give as a psychiatrist to the family?
It's very important part of our screening. Everybody who comes in through our emergency room, for example, is asked about access to weapons. If it is a case where you have somebody who is feeling unsafe, who is having suicidal thoughts, you have a gun in the house, our recommendation is always that be removed.
Right.
Especially what we want to do is create a situation where there's not access to easy means, right? And so having a weapon and having a lethal means like having a weapon in the house is never a good idea when you're having somebody worrying and dealing with their own safety all the time.
And I want to be really concrete about this for our listeners. There's no coming back from that. That's what we mean by lethal means, is that it can be an impulsive decision that there's no coming back from. And there's typically no intervening in saving that person. And so we want to prevent, we want to delay the access to that. And I think another myth about what happens in Rhode Island, I can only speak to Rhode Island about when we assess for weapons, is that one of the myths is you're going to take my weapon away. So could you speak to that? Does that happen? What goes on? What is it that we're asking people when we ask that question? And what do we want them to do?
Right. When we're having this conversation with families, is there a gun in the house? Okay, yes, there is a gun. Where is this gun? Is this gun secured? Is this gun in a safe? Can you change the password to this safe? If it's not secured, is there a way that you can have this gun outside of the house somewhere else that is safe? It's not about having people's guns taken away. It's how can we protect this person and support this person in the best way while they're working on some very serious things. And it's how can we decrease this person's access to something that you can't take back.
Right. Right.
And I think it's key that you said like the impulsivity of it, because for adolescents, we know that they're more impulsive than
just by
any other population.
Yeah.
And that's something that you can't go back in time. So I think that's extremely important. And I really hope our listeners understand that we want a responsible gun owner to take responsibility and put that gun someplace safe. They can continue to have access to it if they're not the person in a mental health crisis, but it's voluntary. We want that to really happen, to keep everybody safe.
We meet families who have guns in their home and they're like, no, there's no way my kid knows the code to the safe, and they have no idea where it's hidden. They know.
They do know. They know everything.
They know. Yeah. They know. When you think they don't, they know. Yeah. And you never want to be in a situation of, that there could have been a change or something could have happened and, can't take it back.
Exactly. What sorts of behaviors would you be concerned about that are happening at home that would indicate to you that you would want the parent to go seek help? What sort of things would be happening at home? What would this look like concretely in the home?
Right.
What do you see? And what would that be? It's time to go to the next step, whether that's they're not in treatment, they need to be in treatment, or they're in treatment and we need to escalate treatment.
What I will say is the first thing is trust your gut, right? I think as a parent, you're the expert on your child. You know when something's not going well. You may not know exactly what, but you know the feeling that you have. Don't doubt that. You know, what's the worst that can happen? Somebody evaluates your child and is like, okay, no, it's okay. Right. They're okay. You guys can manage this at home. In terms of concrete signs to look for, if kids are And we want to make sure that these are more consistent, right? Because kids are going to have periods where they're wanting to spend more time in their room, or they're more irritable, or they look sad, or they're more tearful. But when these symptoms continue over a 2-week period is when we sort of say, okay, maybe we should have things evaluated at the next level. So if people are spending more time, isolating, if they're not enjoying things that they usually enjoyed before, they're not eating well, if they're not sleeping well, if they're more tearful, if they're more irritable, any changes from their regular baseline, that would be an indication.
A lack of interest with friends.
Lack of interest with
dropping
friends.
a sport.
Yes.
Doing poorly in school.
Substance use.
Substance use.
Is a big one. If you're seeing that your child is self-harming, big one as well. And sometimes we meet families and they're like, no, they're just doing that for attention.
Right.
We treat it the same way. It doesn't matter what you think the reason is. It's treated the same way, right? Because a child who is feeling great and is doing well, it's not going to be doing that, right? It's clearly the sign of that they're struggling in whatever way it is, right? And so it's never a wrong thing to try to seek extra support for your child if you're worried.
Go ahead. Let's talk a little bit about substance use, because you mentioned substance use. I can read Dr. Cosmo. So let's talk a little bit about that, because that is becoming, it seems more common. And I think that part of it is social media. Part of it is that this small group of friends that we may have had outside of social media is now a very big group of friends existing in lots of different places. And the legalization of marijuana and people feeling that marijuana can help anxiety, my depression, and it's
everything.
It can self-medicating.
It's self-medicating, and how we can get from alcohol, marijuana, alcohol, and on, and the grave lethality of some of these opiates out there, and again, impulsivity. And needing to belong and all of these things. Could you speak a little bit about what you see with regards to substance use in your practice, and what concerns you?
Yeah, over the last few years, the rates of substance use clinically seem to be increasing. And what's scary about it is, the potency of what kids are using, right? So we're seeing a lot of kids coming in, oh, I'm just smoking some weed, but having a significant psychotic episode requiring prolonged admissions, lots of medications just to get back to baseline. Or we've been having a lot of kids coming in testing positive for fentanyl, thinking that they're using weed. You never know where it's coming from, even though you think you know. You don't really know. And one of the difficult parts is now in the culture where we live in, where, many places is legalized and it's sort of touted to treat every single thing under the sun. In reality, clinically, what we're seeing is that weed and mental health don't go together, right? And there's not enough information about that out there. We see it in clinical settings, but this is not what is sort of expressed out there in the mainstream world. What we know is that if people are on medicines and they're using a ton of substances, medicines may not be as effective, So a lot of the work we do, we're seeing a lot more kids. There's greater access, people don't even think of marijuana, for example, as being a drug. So we'll be screened like, do you use any drugs and alcohol? No. Do you smoke weed? Yeah, I do every day. I'm like, no, that is a substance as well. Right. And with parents too, recognizing that it is a substance, right? And that the marijuana that was 20 years ago is not the same that is now. Right. And it's affecting our kids in ways. You're introducing substances into a developing brain.
Right.
no idea how that's going to turn out, right? So a lot of the work we do is really building insight into, if you're really sort of committed to your treatment and your recovery, how do substances fit into that?
Right.
What is the role of substances for you? What is it providing for you? How can we teach you healthy ways of providing that for yourself?
Right.
And really empowering parents to talk about substances with their children, you know, really create that space where they can have those conversations and really support that treatment too.
Yeah.
What are potential signs that parents can recognize that the kids might be using substance? What they need to be attentive to?
Yeah, you know, changes in personality, you know, a lot of the big red flags that we're seeing, right? So if kids are spending more time isolating, if kids are, you know, appearing more sedate, if kids are more irritable, if kids are, you know, big changes in their personality, you know, it's just big changes in terms of how they're interacting with their family, seeing who their friend groups are and how their friends sort of interacting, right? These are some of the things that we can see. And it's important that we talk to our kids about it. You know, sometimes parents are like, well, I don't even want to ask, because what am I going to do if they say yes? Well, if they say yes, then we can help support you through that, right? It's important that we do know.
Yeah. And this is another myth. This idea that like talking about that is giving idea to the child is quite the opposite.
Or we'll get them upset and disconnect them from you. Whereas one of the main jobs of being a parent is consistent boundaries.
Yes.
But one of the themes that, you know, I think is important for our listeners to hear about is there's so many things you do as a parent to keep your kids safe. You know, you spend hours trying to pick the best car seat to bring them home, and you start, you know, a college fund. You do all of these things. You put plugs in the light sockets. You do all these things, and as they get older, you do want them to feel a sense of independence, but there are still some things that we have to pay attention to, and we have to pay attention to social media and put, you know, alerts on to like what is happening. So you may not have to spy in that way, but direct, it's like, this isn't okay. So there's an alert on here and we're going to track that, just like you do if you're doing it on your cable or your internet or time for internet, all of these things, whether you're going to have gun locks or a gun safe, or you're going to remove the gun from your home if it's not safe to do so, or you're going to directly try to ask about substance use. These are all things that can really help protect the mental health and well-being of your child that are just as important as all that time you spent picking out that child seat, you know, to bring them home safely. You want, you know, it doesn't end. The attention and focus on this matter doesn't end.
And I think as a parent, right, if your child's having a hard time, your natural inclination is, I want to do everything to support my child. I want to do everything that I can do to make them feel better, to get them to feel happier. Right. But in reality, a lot of times, you know, for example, okay, my child's calling me from school. They're having a hard day. It's okay. So I'll go pick them up and let's go get our nails done, because that's going to make them happier and feel better. In reality, some of those things can really sort of enable the underlying mental health concerns. So for example, kids going to school, right? Okay, I can't go to school. It's okay. It's okay. Over time, makes it so much harder for a kid to actually get into school. And so a lot of the work that we do with a family is sort of, you know, empowering parents to say, it's okay. You know, yes, I understand that you're struggling, but this is sort of how we need to do that. And it's okay to parent when kids are struggling. In fact, it's helpful.
It's advisable.
Yes.
Yeah. Definitely. You know, I think a big part of child psychiatry, remember in my training, one of the big things that we said is never worry alone, right? And it, especially in child psychiatry, it's very, very important. It's really about having that village around this child to support this child and the family and everybody involved in whatever way possible that is needed.
Exactly.
Thank you so much, Dr. Phillip. It was great to have you here.
Thank you so much for having me. You know, I really appreciate the opportunity to talk about, you know, child mental health and, you know, really have these conversations. So thank you so much.
Thank you.
Great. Thank you. And now a take-home message to bear in mind.
Living with mental illness has the potential to impact so many aspects of a child's life. It has been associated with challenges in peer relationships, academic performance, and increased risk for substance abuse, among other high-risk behaviors. But it is important to remember that with appropriate treatment, many young people with mental illness can live happy and fulfilling lives. Thus, it is important that we work together as a community to decrease the stigma surrounding mental illness while increasing access to care in an effort to provide more young people with effective, potentially life-changing or life-saving treatment.
If a child or adolescent in your life is suffering or experiencing suicidal thoughts, please connect with one of the following resources. Listeners in Rhode Island are encouraged to call KidsLink at 1-855-543-5465, which is a free confidential phone line that connects parents and caregivers to clinicians who can support you in determining the appropriate next steps in care for your loved one. Additional resources for those experiencing a psychiatric emergency include calling 911, a local crisis line, or 988 to access the suicide prevention hotline.
Thank you for listening to our podcast. For more information-related content, please check out our Instagram, Facebook, and YouTube channels. Bear in mind the Brown Psychiatry Podcast. Thank you.